Highlight the staggering number of individuals affected by infertility. According to the survey, around 17.5% of the adult population, so nearly 1 in 6 people globally, experience infertility at some time in their life. But what causes this? What are some of the treatments available? If you struggle with any infertility issues yourself, or indeed need some advice, feel free to get in touch with us here on the show on 4001, on the app or the WhatsApp. You don't need to put your name on if you'd rather not, of course. But we've got Dr. Monika Chawla with us. She is an MD in obstetrics and gynecology at HealthPlus to answer any questions that you might have. How are you, Dr. Monika?
Hi, I'm good, Helen. How are you?
I'm really well, thank you. And thank you for bringing this to light and offering some advice, because I think it's so important to get some clarity around this, but also get some tools and knowledge and a bit of a plan for anyone who might be in that number that the World Health Organization has just brought to light. Before we get to messages that have come in already, I wanted to ask, what is meant by that term infertility? What kind of definitions or parameters are we talking about?
Right. So infertility, as you just rightly pointed out, is such a global health issue right now, and recognized by the WHO, so becomes much more important and could just affect anybody, regardless of race, ethnicity, nationality, even social or educational backgrounds. Now, how do we define infertility? So there are two kinds of infertility, actually, primary or secondary. Primary means that the woman hasn't had any pregnancies in the past. Secondary would mean that she's had some pregnancies in the past, either a baby or even a miscarriage would classify her as a secondary, infertility. Now, how do we define it? When a couple has been trying for more than a year of unprotected regular sexual intercourse and has not been able to conceive, that's what infertility is. But this 1 year duration can be, when the woman is more than 35 years of age, this is reduced to 6 months.
Okay.
So you can understand the importance of age there a bit. Yeah.
You've just mentioned female infertility there, and I wondered if we could perhaps speak to the male side as well, because that's obviously a factor. Takes two to tango.
Absolutely. So the important thing is that we have to remove this gender bias which happens in fertility all the time, and that's the whole idea of WHO addressing it as well. So we bring into light that infertility causes could be, say 1/3 of cases could be female, 1/3 of cases could be male, and 1/3 of cases could be a combination of male and female. So there's no way that, males have to be kept out of it. In fact, we have to address that part of it. Now, the male infertility part obviously means that there are problems with the sperm, and of course there are risk factors which lead to that, and there are causes which could be directly there, or sometimes they are so hidden that we have to, investigate, and even the most healthy looking men, could be suffering from that silently, and we wouldn't know unless they're investigated.
Well, let's talk about that diagnosis then. And you mentioned there, a couple, so certainly where the female is 35 years up, looking at 6 months of trying before coming in to speak to an expert such as yourself. In younger couples, around a year. Let's kind of demystify what might happen if someone was to come into clinic and say, do you know what, we're both on paper very healthy, we're under 35, we've been actively trying and tracking for a year now. What are some of the questions or indeed investigations that an expert would do in order to start making a bit of a plan, Monika?
Yeah, so what happens is that obviously the history is extremely important. There would be certain markers in the history which would, point towards some particular causes, like, of course, age, as you just mentioned, but also in a woman when there's a history of irregular periods. That could point out towards some of the hormonal kind of ailments that could be there, which are not letting her ovulate very well. For example, polycystic ovaries, and people know it very popularly as PCO. But sometimes these irregular cycles also could be pointing out at a low ovarian reserve. And this is an important awareness which I think women should have nowadays as to what is ovarian reserve. So we evaluate that, of course. The other thing is about evaluation of the patient, which we check the weight, actually more accurately what is known as the body mass index, which is a combination of weight and height, which becomes extremely important. That could be a factor in fertility. History of pelvic infections is extremely important because that could point towards some tubal factors sometimes, because the tube is extremely important in actually being the seat for fertilization. If she has history of any fibroids in the past, any interventions in the past, like even an ectopic pregnancy, could point out towards some of the possible causes. In the male, if there's a history of any infections in the past, if he had history of mumps in the past, for example, Also lifestyle, how it is, whether there's a lot of smoking, if there's alcohol, if there's a lot of caffeine. This is common to both females and males, and we have to dig out this history to know if any of these contributory factors could be existing. And of course, if there are genetic issues which are not really known unless they are investigated. So these are the kind of things that we're looking at in the history. Following that, we have a hormonal analysis, which is usually a blood test. It involves checking the ovarian reserve, which is called as AMH. It's a very simple blood test which will tell me what could be the approximate number of eggs in this woman at this age. Then, of course, a lot of hormones which are very, very vital to the functioning of ovaries and the pituitary. And then we go for some of the important essential tests, such as the tube test. As I just mentioned, tube is an extremely important structure. You have to check if it's open, if there's a history of any kind of infections in the past, which could have led to scarring of the tubes or blockage of the tube. You need to find that out. And sometimes you have to go on to further investigative modalities like laparoscopy. And all these together then, and of course for the man, the first thing to do is a semen analysis, which gives us a lot of information.
It's a lot going on. We've had questions for you, Dr. Monika, and I want to ask you next. You've been in the business. I've been MD since 1998. I'm curious to find out, is infertility on the rise? And if so, why? If you've got any questions for Dr. Monika, joining us here from HealthPlus this afternoon, she is obstetrics and gynecology. This is your chance. You can be anonymous on the text line 4001. Is infertility on the rise? And how do you determine what the best course of treatment is? We'll be talking about that next.
This content is for informational
Health Organization that is saying a staggering number of individuals are affected by infertility. According to them, around 1 in 6 people globally experience infertility at some time in their life. Talking causes now and indeed treatment with Dr. Monika Chawla. She is an MD in obstetrics and gynecology, decades of experience, and at HealthPlus. Speaking to us now live on the phone and taking your questions as well. I wanted to ask then, in light of your experience and of course, greater access to data and surveys, do you feel like infertility is on the rise? And if so, why, Doctor?
So I have to admit that with all the the data that we have right now from the past 1 or 2 decades, it seems that infertility is definitely on a rise with this global industrialization and a lot of other factors. So one main factor is that obviously women with increasing career opportunities, educational opportunities, and doing extremely well in their professional life, somehow voluntarily the fertility choices have been delayed. And as we know, there's a biological clock which doesn't wait for anyone, and somehow the average age of getting pregnant is getting delayed more and more to more than 35 now. And with obvious reasons, with egg quality and egg numbers reducing at that age, definitely more couples are, seeing us who want to conceive. So definitely on the rise. Secondly, with our lifestyles, currently with a lot of sedentary lifestyle, obesity on the rise, smoking, alcohol, and somehow caffeine has become a part of our life, again has some deteriorating effects on the sperm. And sperm quality and the numbers and the parameters are kind of reducing. This has been seen over the last decade in many studies. And then the exposure to toxins, environmental toxins, and things which we get exposed to inadvertently without knowing is also more and more, because industrialization is increasing, and there are a lot of, professionally we get exposed to a lot of these things, lead, mercury, arsenic, and somehow silently, yes, there is some silent kind of, subtle damage which goes on for years, and all these things are contributing. But the main is about, we're talking about the biological clock, which, we've taken it in our hands, but somehow we have to kind of, understand that it's something which is controlled by the number of eggs.
Yeah, it's interesting. I've got a friend who works a lot with the IVF, I don't say community, but people going through IVF in the UAE, and her big message at the minute is freeze your eggs, and perhaps give this as a gift to your daughters when they're 18, and really raising awareness of, I think many of us do forget or simply don't know that when a girl is born, she's born with all the eggs she will ever have. That is
Absolutely.
a finite supply. And when are you at your most fertile then, in terms of age bracket? And it would be amazing if we could plan these things, that you'd meet the right person, their job would be sorted, and you could have a baby just at the right time. Life doesn't work that way, but out of curiosity, are you able to identify, an age bracket in a woman's life where she is the most fertile, Dr. Monika?
Yeah, definitely. We know that the late teens or the early 20s, say 23 to 25, 26 years, that is the most fertile age bracket. And if I just count it in terms of number of eggs, when we are born, we have 2 million eggs, and then they are reduced to say about 200,000 when you start getting your periods, and they become 20% of what you were born with at 25 years. So they're already reduced. And that's the time. The late teens up to say 25 is probably the most fertile period that way. And then they get reduced to 6% of what they were at 35 and 3% of what they were at 40 years. So you can imagine that obviously the most fertile period lies at that kind of age bracket and reduces thereafter.
Dr. Monika, you were talking earlier about, the history that you need to give in terms of medical history, lifestyle factors. How do you then determine which fertility treatment is right for a particular patient? Can you unpack that a little bit for us?
Sure. So obviously it would depend upon if we find out a particular causative factor which can be corrected. That's one thing. The age of the couple in general. Now let me also highlight it's not just the age of the woman. It is also the age of the man, which is important, though they don't have a typical biological clock, but definitely after 40 years, their sperm also starts kind of, going down in terms of numbers, in terms of quality. So age is important to determine what kind of, treatment we would offer to them. The duration that they've been trying becomes important as well. If they've been trying for 3 years and there's just no problem at all, it is classified as unexplained infertility. Everything seems to be fine, but then there are factors intrinsic to the body which is somehow not supporting conception. So in these kind of cases, of course, a different kind of treatment would be offered. And of course, what are the kinds of treatment? Of course, in cases who have just been trying for not too long, lifestyle modifications work like wonders. Loss of weight, but also it's important to know that both high body mass index and low body mass index are important. We don't want extreme weight loss. We don't want a BMI of less than 18. Again, it starts adversely affecting conception. So lifestyle modifications are helpful. A good lifestyle, a healthy diet, having a regular moderate level of exercise, good sleep, reduce level of stress as much as possible, reduce consumption of alcohol and caffeine. These are the lifestyle modifications. It could work in a lot of people, and if you give them some time over 6 months with monitoring, sometimes they conceive on their own. And going to the next level of treatment is medical treatment, where we could offer some fertility medications, which are basically sometimes just pills, simple pills which could help them ovulate, which could help them boost their, the number of eggs that we're getting in a particular cycle. This is the medical treatment of it. Of course, there are hormonal, corrections that are needed sometimes, like thyroid is not working well. These are all playing a very, very, critical role in ovulation. So correction of thyroid problems, correction of prolactin issues, which is called the milk hormone popularly. So these could, again, be done, and sometimes it could work for patients who've not been trying for too long, and they don't deserve probably go to the next step. Third is the surgical level of treatment, where, for example, if there are tubal blocks which can be corrected by laparoscopy. Sometimes there are fibroids which are interfering with conception. So these can be surgically removed, and again, spontaneous, pregnancies might happen. And then, of course, there will be always a percentage of patients who are not conceiving despite these corrections, who have been trying for a good duration of time, say 2 to 3 years or more, everything seems to be fine, or there are problems with the tubes, for example, if there's a tubal block, or if there's a sperm which doesn't really appear in the ejaculate and the man needs a kind of a surgical, collection of the sperm. In those cases, definitely IVF is the way to go forward. So that is the next level, which is called assisted reproduction, which has got basically two components to it. One of them is called intrauterine insemination, which is quite a simple process, very much natural, whereas IVF is a little more detailed, but very, very highly successful. And if you ask me which is the most effective treatment or the most successful in such cases, especially the last fraction that I talked about, is IVF.
Thank you for that. Hopefully that's offered some clarity for people listening today. And we've had a number of messages asking about specific problems, which clinic should I go to, etc., etc. I'm going to reply to you privately with, as I said, if anyone's looking for advice in terms of which clinic to go to, which doctors to go to. It's so personal, and there's some amazing experts here in the UAE, but there is a group called IVF Support UAE, and they're fantastic at offering that kind of matching and advising. One last question to you. Hopefully we can offer some clarity to this listener, Monika, saying, can you fall pregnant during the pre-menopause stage? Are you able to quickly explain that for us?
So, I'm constantly highlighting that age is such an important factor, and the chance of getting pregnant on your own in the pre-menopausal stage, which you could say over 40, where, the egg numbers would have dropped to 3% of what you were born with. The chance of conception is roughly 1 in 10. That means spontaneously every cycle could offer you like a 5 to 10% chance of getting pregnant, which is obviously half of what would happen before, less than half of that. So obviously pregnancies rarely could happen, but you have to be really lucky.
It's not impossible.
It depends on your perspective. It's not impossible, absolutely. Nothing is impossible. I see these miracles all the time, and I'm glad to see them. It's just that in a case where a patient wants to get pregnant, to totally depend on spontaneous conception would be a bit of a problem. So, yeah, but of course it's possible. It's definitely possible. Say 5 to 10% is definitely there. So,
Monika, for anyone that wants to reach you privately, indeed work with you there at HealthPlus, what's the best way of getting in touch, and where can we find you?
Well, I'm available in HealthPlus all the time. I work in Abu Dhabi, and they could reach me through the call center. I also have, of course, an Instagram account where I keep educating people, so maybe they can find me there at Dr. Monika Chawla. And I'm happy to answer queries on Instagram all the time, or through HealthPlus, they can come and see me anytime, available, also on a phone call. Everything is possible. So I'm in UAE and very much available all the time.
Really appreciate your insights today, and thank you for taking my questions and everyone else's. Coming back to your point about lifestyle factors, Julie Mallon, sleep consultant, saying lots of studies are showing poor sleep is contributing to infertility issues. I've seen this time and time again in men and women, so absolutely look at that lifestyle. Dr. Monika from HealthPlus, thank you so much for your time. And if you want Dr. Monika's details, just send me the word health and I will happily send you her information. Equally, the same for IVF Support UAE. Send me IVF and I will send you that group.
This content is for informational purposes only.